Hi, my name is Dr. Schmid of Contemporary Cosmetic Dentistry in Austin, Texas. I want to talk to you today about the process of getting veneers. With my process, I actually have an extra step that a lot of dentists don't use, and that's using a wax up with temporaries. The temporaries are important because it gives us an opportunity to see the size, shape, and position of the teeth. And without that, I couldn't create the type of smiles that I create. I know there's some dentists that like to have their cases completed in 4 days. I couldn't provide the kind of quality and lifelike smiles that I provide without using the temporaries. The first step in the process is to gather records. We do this with photos, x-rays, models, and then I send this off to my lab. And we sit down and we discuss this, the case. We discuss exactly what we want to correct and how we're going to correct it. And then the lab does it with wax. They create a wax up that's basically the patient's new smile, but it's in wax. They send everything back to me in terms of what I need to take this patient from where they are initially into temporaries that look just like the wax up. That takes about 2 weeks to get it back from the lab. After that, usually I bring the patient in at least one time to look at the temporaries, to look at the size, shape, and position of the temporaries so that we know that these things are perfect in terms of the patient's mind and my mind. You can't do that the day that we actually put the temporaries in because the patient's numb and they can't smile. So you have to bring them back to verify where the incisal edges are, where the teeth are in terms of the lips and soft tissue. Once we decide that the patient's happy and I'm happy with the temporaries, then we send them off to the lab. We send our information and impressions off to the lab where the ceramicists start to work on the porcelain. That process takes about 3 weeks. The porcelain comes back to us. We come back in and sit down and take off the temporaries and then place the porcelain. Typically there's one post-op visit so that we can look at the occlusion, make sure that everything's cleaned up, and that's it. From time to time, some patients do tell me initially that they're surprised at my process and that it takes longer than what they've heard. They ask me, why can't you do it in 3 or 4 days like some of these other people? But once we're done with the process and they've actually experienced it and they were able to give their input and seeing that we're going to take as much time as we can to get these smiles looking perfect and natural, they're totally happy with it and they understand. Again, this is Dr. Schmid. I hope this information about the process of getting veneers has been helpful. I look forward to meeting you.